Good morning, everybody. Thank you for being here with us today. We appreciate your time this morning. My name is Katie Earle, and I'm the coordinator of the University Express program, and I work for the Erie County Department of Senior Services. And we're joined here virtually today with Jeannethe King from Excelsior Orthopaedics, and we're very excited to have her here to give her presentation. We'll let you know first thing that we are recording the session, and I'll try to post it online at a later date. And we have a lot of regulars on here today, so thank you again for joining us. I think you know how to access your Q&A panel, so if you have any questions as Jeannethe goes through her presentation, please feel free to type those into me, and we'll try to get to as many as we can at the end of her session. So I'd like to thank the sponsors of our program, which is my Department of Senior Services, Blue Cross Blue Shield of Western New York, Excelsior Orthopaedics, and Wegmans for everything they do to help make the program possible. And as always, please don't hesitate to contact us at Senior Services if you have any questions about programs, services, or benefits. We're happy to help you out. We're at 858-8526. All right, so Jeannethe King received her doctorate of physical therapy from Damon College. She has an MS in athletic training from Long Island University, the Brooklyn campus. She played Division I women's soccer at LIU for 4 years, and Jeannethe integrates her sports medicine background of physical therapy to create functional programs. She returned to Buffalo in 2015 to be closer to her family, and we're happy to have her here today. Jeannethe, thank you. Take it away.
All right, thank you, Katie. Welcome, everybody. I will be doing a presentation called Is Physical Therapy for Me? And as Katie kind of talked about my background, I wanted to give a quick introduction about myself. I went to Long Island University in Brooklyn, and I was there to play college initially. I got my bachelor's in science, and then I got my master's in athletic training soon after. I decided if athletic training wasn't for me, decided to move back home to Buffalo, where I went to Damon College and got my doctorate in physical therapy there. While working on my doctorate, I was part of Catholic Health, part of their Per Diem team, working as an athletic trainer, mostly in the Catholic schools around Western New York, in particular Nardin, Mount St. Mary's, St. Francis, and St. Joe's. I did my first clinical stint, or I should say my first professional stint in a clinic in New York City called Professional Physical Therapy. And I was there for less than about 6 months before deciding to move back home to Buffalo, which a lot of people do, and landing my job at Excelsior Orthopaedics in December of 2015. So I've been there since 2015. The last 2 years, I was a site leader at the Sheridan office. And now I currently reside in the downtown office in Buffalo, and I'm their site leader currently. So a little bit about Excelsior Orthopaedics. Excelsior Orthopaedics was officially formed in 2012. Our main campus is on Sheridan Drive, where we have medical offices as well as physical therapy offices. And so that's our main hub in Sheridan, and then we also have offices in Orchard Park, East Amherst, Niagara Falls. And then we just started our first satellite location in downtown Buffalo with just physical therapy and occupational services. We employ over 300 local Western New Yorkers, which include physicians, PAs, nurses, physical and occupational therapists, as well as athletic trainers. So what does Excelsior do? Excelsior examines and treat orthopedic conditions. We have x-rays and MRIs. We have a Buffalo Surgery Center, which a lot of our doctors perform some of their surgeries in this facility, as well as kind of localized hospitals in the area. We treat concussions. We have a durable medical equipment department, which we supply splints, canes, braces, any kind of post-op needs. We have a sports medicine and training department as well, which a lot of our athletic trainers are housed out of. We have a wellness center with nutritionists and physical therapy and occupational therapy, which I reside in. So what is physical therapy? Some of you are lucky enough not to have any kind of form of physical therapy, lucky you, which is why you're here today. So physical therapy is therapy for the preservation, enhancement, or restoration of movement and physical function impaired or threatened by disease, injury, or disability. It utilizes therapeutic exercises, physical modalities such as massage, electrotherapy, ultrasound. We use assistive devices, and we make kind of more of a movement analysis to see if a patient would need an assistive device depending on how they're walking. We do a lot of patient education regarding their diagnosis, whatever their injury is. and we have manual intervention, which is hands-on care. Physical therapists are movement experts who improve quality of life through prescribed exercises, hands-on care, and patient education, like I just said. Depending on the setting, we actually diagnose and treat individuals of all ages, from newborns to people that are at end of age, or end of life, I should say. Many patients have injuries, disabilities, or other health conditions that need treatment, but PTs also care for people who simply want to become healthier or prevent injuries from occurring in the future. We examine each person, and then we develop an individual treatment plan based on their needs and their limitations. We help reduce pain and management, restore function, and prevent disability. So where can you find physical therapy? We're in a range of settings. We're in hospitals, outpatient clinics, we go to people's homes, we're in schools for kids, we're in sports and fitness facilities, workplaces, and as well as nursing homes. So what does an outpatient orthopedic setting kind of look like, and why would you go to an outpatient orthopedic setting? It's physical therapy that is a treatment that focuses on improving the function of your orthopedic or musculoskeletal system. So what do I mean by saying musculoskeletal? I'm talking about your muscles and tendons. I'm talking about your ligaments, bones, joints, and more often than not, herniated disc, because a lot of people do have low back pain or neck pain. So when I'm talking about muscles, more often than not, I'm talking about a muscle strain. Some people get this confused with sprains, and that's more considered more for ligaments. So a muscle strain, or also called a muscle pull, refers to a tear within the muscle or damage to the muscle and its attaching tendons. You can put undue pressure on muscles during the course of normal activity with sudden heavy lifting during sports or while performing different kind of work tasks. Some of the symptoms or signs of a muscle strain may be swelling, bruising, or redness due to the injury, pain at rest, pain when you're trying to engage that certain muscle or the joint in relation to that muscle, weakness of muscles or tendons, or inability to use the muscle at all.
Forms of arthritis that, like I talked about, is rheumatoid arthritis. It occurs when your body's immune system attacks the tissues of your body, and these attacks often kind of concentrate and affect the synovium, which is the soft tissue within your joint that produces fluid that nourishes the cartilage and lubricates the joint. Rheumatoid arthritis is a disease of the synovium that will invade and destroy a joint in particular, and it can eventually lead to the destruction of bone and or cartilage inside the joint. And through research, they found that if you have a genetic marker related to rheumatoid arthritis, your risk of developing it down the future is 5 times the amount. Most people with arthritis notice more of their symptoms are worse in the morning compared to later in the day. The arthritis in general affects more people of the age of 65 and older, but it can affect children, teens, and younger adults. Women are more susceptible to arthritis compared to men, just due to bone structure. And some of the symptoms of arthritis is joint pain, stiffness, swelling, decreased range of motion, redness of the skin, and redness of the skin around the joint. A lot of our patients of the older population really come into us with low back pain, and that's when our evaluations kind of come in hand. Is it more of a muscle strain, or is it more of a herniated disc? A herniated disc refers to a problem with one of the rubbery cushions, which is referred to as disc, that sits in the individual bones that stack up to make the spine. So as you see in this lower right-hand corner, this is your vertebrae, this is your spine, and in between your vertebrae is where the disc sits. A spinal disc has a soft jelly-like center, which is called the nucleus, which is encased in a tougher rubbery exterior called the annulus. Sometimes a slip disc or ruptured disc, which is also known as a herniated disc, occurs when the nucleus pushes through a tear in the annulus, and then it compresses onto a nerve. A herniated disc can occur in any part of the spine, and then it can affect the nearby related nerve. Most herniated discs occur within the lower back, although, like I said before, it can occur in the neck. Signs and symptoms depend on where the disc is situated and whether the disc is pressing on a nerve. And they can affect one side of the body or both sides of the body. Symptoms of a herniated disc is arm or leg pain. If your herniated disc is in your lower back, you will typically feel pain in your buttocks, thigh, or calf. You might have pain in your foot as well. If your herniated disc is in your neck, you'll actually feel pain in your shoulders or arms. The pain might shoot into your arm or leg when you cough, sneeze, or are put in a certain position. Pain is often described as sharp or burning. Numbness and tingling is also an associated symptom of a herniated disc. People who have a herniated disc often have radiating numbness and tingling in the body part that is affected by the nerve that is innervating, as well as muscle weakness. Muscles served by the affected nerves tend to weaken, and this can cause you to stumble, or it can affect your ability to lift or hold items. Who needs physical therapy? People with injuries from a fall, trauma, or overuse injuries. So any of the other strains, sprains, fractures would benefit from any kind of physical therapy. People that have had surgeries and need help into recovering and restoring their function. Your doctor may suggest physical therapy for long-term health problems such as arthritis, poor posture, and poor balance, or if you have an increased risk of falling. So fall risk. Many falls do not cause injuries, but 1 in 5 falls does cause a serious injury such as a sprain, strain, broken bone, or head injury. These injuries make it hard for a person to get around, do everyday activities, or live on their own. Some statistics around falls is there's approximately 8 million emergency room visits each year because of a fall. Of those falls, roughly 12% are slips or fall accidents. When you slip and fall, there's a 5% chance that you're going to break a bone. A slip and fall can cause serious injuries in about 20 to 30% of its cases. Falls are the most common cause of brain injuries and hip fractures. Approximately 1/3 of adults over the age of 65 fall each year. And the astounding part of it, medical bills for a slip and fall injuries are around $34 billion each year in the U.S. So if you're realizing that you're falling more than 2 times in a year, and you are telling your doctor that this is a red flag that you may need some kind of restorative function, whether it's increased strength, increased flexibility, increased balance, and proprioceptive feedback, that may help prevent this in the future for you. As we get older, bad habits such as slouching and inactivity cause muscle fatigue and tension that ultimately leads to poor posture. And poor postures kind of cause rounded shoulders. It can cause a pot belly, bent knees when standing or walking, a head that either leans forward or backwards, back pain, muscle aches, muscle fatigue, and headaches. So we're realizing, or you're going to your doctor and he's seeing how you're positioned when you're standing or sitting, and you're telling your doctor that you're having more headaches or you're having shoulder issues that you're not typically used to, he also might send you to physical therapy to help improve your posture overall. So what does a physical therapist do? On your first examination, it's called the evaluation, and we're asking you about your day, we're asking you about your symptoms, we're asking you what you're having trouble with, what your daily activity is, or getting an overall sense of what the issue is in general. We assess the involved joint regarding range of motion, strength, and flexibility. We're then doing a functional assessment. What does that mean? We're looking at how you're walking, we're looking at how you're balancing, we're looking at how you're getting in and out of a chair, going up and down stairs. We're looking just about your body motions and how you're performing each task. We're completing special tests, meaning we're isolating and targeting specific muscles, cartilage, or ligamentous structures within a joint to see where your source of pain is coming from. The goals of PT is to move your joints better, to restore and increase your flexibility, strength, endurance, coordination, but it also is to make sure that we're able to achieve your goals. We're asking you, what do you have trouble doing? What do you want to get out of this? And we're trying to kind of progress you each time that you're in physical therapy to your ultimate goal. We do an assessment of your gait pattern, and we see if we need to give you any kind of assistive devices that can help with your pain or help with your balance, such as crutches, a straight cane, a walker, whatever the need is. to make sure that you're safe while you're walking or ambulating at home or in the community. But what's most important is that we're doing an individualized treatment plan for each patient that's walking in. So it's not really cookie cutter. You might get squats, and then the next patient next to you might get squats, but it's due to either weak glutes, or we want to improve your core, or whatever the issue may be. So what does a physical therapy evaluation kind of entail? So basically what I just said, we call it a SOAP note. We have a subjective, which is what we're asking you in the beginning. We have the objective, which is your measurements of your range of motion and your strength. We have the assessment, which is where we get through the special tests. And we have a plan of how we're going to help progress you and restore your function. So at physical therapy at Excelsior, this is what it includes. When you come in on your first day or on your second day, we're asking you, how are you feeling? Did the exercises make you feel better or worse? Is anything getting better? Is anything getting worse in terms of your pain and your function? Do you feel any percent improved or any percent worse in general? We give you a gentle cardio warm-up in the beginning, whether you are in the upright bike, the elliptical, an upper body ergometer, something to improve and increase your heart rate. We give you core exercises because your core is the fundamental base of both limbs of your upper body and your lower body. So everybody needs a strong core. Automatically, we're working on balance. Whether it's balance on the floor, just standing next to an object to make sure you're not going to fall, or we put you on an uneven surface to make sure that you have that proprioceptive feedback. So if you're walking on a pebbled or you're walking on uneven surfaces, we can improve your ability not to fall at home or in the community. We take you through strength exercises and flexibility exercises. We are always correcting your posture, not only correcting your posture, but also correcting your form in general. We're giving you feedback with our hands, and we're giving you feedback with our voice. There is a manual intervention aspect, and we are always improving or updating your home exercise program to get to your final goal. So what kind of manual interventions are there? There are joint mobilizations. What is a joint mobilization? It's a physical therapy technique designed to relieve pain and muscle spasms, release tension, and improve flexibility in the joint. By increasing a client's awareness of the correct position and movement of the joint, and it's stimulating smooth joint function, joint mobilizations can also help improve range of motion, flexibility, and mobility. We are doing some kind of stretching, stretching of the upper body or the lower body, depending on the involved joint. We are doing some type of soft tissue mobilization. Soft tissue mobilizations is a form of manual physical therapy where your licensed PT uses hands-on techniques on your muscles, ligaments, and fascia with the goal of breaking adhesions and optimizing your muscle function. So what are adhesions? Adhesions are your body's attempt to heal a soft tissue injury with a lengthy inflammation process resulting in long strands of the cartilaginous scar tissue. These new tissues pull against one another, forming some point of trigger point pain. We are doing passive range of motion, so the therapist is passively moving their joint within their functional range. And at Excelsior, we use ASTEM. So ASTEM doesn't stand for anything. ASTEM is its own entity, and it's under the subcategory of soft tissue mobilization. If you look in the lower right-hand corner, you'll see a man using a tool on the skin. So these tools are used to go directly on the skin and kind of help decrease any kind of adhesions, soft tissue adhesions, increase your range of motion, increase circulation. It's more of a stimulus to restart the healing process. Key fact to know, treatment may cause mild soreness or swelling, but that's normal. But you should always communicate with your PT to make sure it's not too much pain or too much swelling. Communication is important. I always tell my patients in the beginning that I need to know what they're thinking. I need to know what they're feeling in their body. I'm not going to be able to tell everything. In order to have a successful program, you need to have feedback on both ends. I don't want a patient leaving in more pain than what they're coming in. Consistency is key. What I mean by that is coming into physical therapy just 2 times a week for 45 minutes really isn't going to do too much compared to if you're coming in 2 times a week, but you're also doing your exercises at home 3 times a week. Consistency in a program of any type is key to see progress and to restore your function. The other thing to know is physical therapy is more often than not is interdisciplinary, especially at Excelsior. We are talking constantly to occupational therapists, to their doctors, to their PAs, to either their primary care physician to make sure we're all on the same page. If you're being referred to us from an Excelsior doctor, we have that communication and that straight line of talking either directly or through Medent, which is our medical electronic report that we use. So if something's not working for us, we're able to directly contact and directly have that communication with the doctor. If we're being referred from a primary care physician, I'm always calling the primary care physician after our initial eval to say how they did and what I think they're going to benefit from. So we work as a team here at Excelsior. And in particular, we work in a team as well because we are also housed with athletic trainers when we work, when we come to work. So when you come to me, not only are you going to be seeing me, but you're also going to be coached by an athletic trainer as well. And these athletic trainers have the skill set as well as the education to give you the feedback and as well as to answer the questions that you need. And if they don't know the answers, then they're coming to us, and then we're kind of talking together to make sure we're getting the right information back to the patient. So what do you need to start physical therapy? More importantly, you need comfortable clothing, okay? So try not to come to us in a dress or up to your nines, but you need comfortable clothing that you can move in. You need supportive and non-skid shoes and or sneakers. And more often than not, you do need a valid script. There are some insurances that you don't need a valid script, and that is called direct access, where you can come into physical therapy for up to 10 visits or 30 days, and we can treat you directly without you even seeing a doctor. But it varies from insurance to insurance. More often than not, each session is about 45 minutes to 60 minutes, and we do a full evaluation and treat your symptoms on the first initial visit, and then after that, we go through all your exercises and help you with the education aspect of your injury and of why we're doing each exercise in particular to make sure you understand the full scope of the why. Does anybody have any questions?
Nettie, thank you so much. We actually do have quite a few questions.
Okay, yeah.
All right, so the first one I'm seeing is, do you help fit canes and walkers?
Yes. So at Excelsior, we do sell canes. However, we do not sell walkers. Sheridan Medical Equipment is where we kind of refer most of our patients to in terms of getting a walker.
Okay, thanks. And then if somebody got one, would you help them fit it to the appropriate size and height?
Absolutely. We would not only help fit it, but we also make sure that you're using it correctly, and that to make sure that you feel comfortable when using it.
Okay, thank you. Next question is, are herniated discs more common as we age?
It depends on your strength, to be honest. There's a muscle imbalance that may put you at higher risk of a herniated disc if you don't have the good stability and compactility of the spine. As you know, you get more sedentary and you stop moving as much and you stop being active. So that does go in line with more prone and more risk of having a herniated disc.
Okay, thank you. Next question, what are the average number of visits for someone who has arthritis in the knees?
It depends on the severity of their arthritis. If you are coming to us with arthritis, it is more often than not because your doctor thinks you would benefit from physical therapy. And it sometimes can take up to 8 visits, but other times it will take even longer than that and be more about 15 to 18 visits. It depends on, again, how much joint space you have in your joint and how bad the arthritis is.
Okay, that makes sense. What does ultrasound do?
Ultrasound uses sound waves, and it helps increase the tissue warmth. There's different objectives and different theories of the settings of how you use ultrasound. Here at Excelsior, I'm not going to lie, guys, we do not use ultrasound or electrical stimulation. We're more on the hands-on approach of using more of the manual techniques of joint mobilization, stretching, and passive range of motion. But there is a therapeutic effect with ultrasound, which is why PTs do use it in some clinics. And that's more for decreasing swelling and increasing the circulation and moorings of the tissue.
Thanks, Betty. Next question, what is the special test?
So a special test, it refers to different positions that we put a joint in to see if the pain is coming from, cartilage or a meniscus, or if pain's coming from more of a ligament. It's all hands-on, and it's basically, we try to recreate more of the patient's symptoms to elicit what the source of the pain is. Each joint has its own special test. Each structure has their own special test. So there's just not one special test for all the joints. And there's not just a machine that kind of you go through, but it's more me moving your joint and your limbs around to elicit a pain to see, for me, to see where the source of the pain is coming from.
You have to know a lot of things, Nettie.
Yeah.
Next question, are there any parts of the body that lose strength with age, like core, legs, or arms?
Every part of your body loses strength with age if you stop moving and you stop being active. In particular, starting with the core, but then going into the muscles of your legs and your glutes, your shoulders, your rotator cuff. If you stop using it, it stops the strength. You stop it. One thing I tell my patients is, if you stop being active, if you stop going to the gym, within 2 weeks you lose muscle tone. Within 2 weeks you lose muscle strength. So if you think of that and put it into a long-term effect, you definitely lose strength as you age. If you stop being as active as you were in the past.
Okay, thank you. Next question, can you explain what traction is?
Traction is a part, it can be a manual treatment or it can be done through a device in which you are using a more of a distraction of your limbs to create more space within a disc or within your joint. And it uses it to kind of flush some of the fluid within the joint. And it decreases some of the pain because you're not having that direct pressure through the bones. Some people say that it relieves their symptoms or relieves their pain in the low back. Some people really benefit from traction because you don't have that direct pressure within the joint spaces anymore.
Okay, thank you. Next question, what are your thoughts on cupping?
Cupping can be very beneficial depending on the location, depending on how tight your muscles are, depending on if you have any trigger points. The thing with cupping or anything in particular before you have it is to have a good evaluation done prior to doing it. So hopefully the person that's doing the cupping is not just going to automatically go into a room and cup you. They're looking at your range of motion. They're looking at your muscle structure. They're palpating your muscles to see which ones are tight, which ones are weak. And then they're making a full assessment to see if you would really benefit from it.
Okay, thanks, Nettie. We have a couple more questions here. Is that all right? Sorry for the rapid fire.
Oh, go ahead.
Okay. Next, the person's wondering, what is the difference between a herniated disc and a bulging disc? Thank you.
So a herniated disc is when the nucleus is kind of protruding through the annulus tears, like I talked to before. A bulging disc is another form of a herniated disc, but it's a little bit more severe. So you have a little bit of protrusion with a herniated disc. With a bulging disc, it's I want to say it's about 50% out.
Okay, thank you. Next question is, well, comment rather. I know I need to lose weight to feel better. Should I start with PT now or wait till I am at my goal weight?
I would say talk to one of our nutritionists. Our nutritionist gives each of our patients a full treatment plan or a full nutritional plan. But also, if you're having pain, come on in. If you're having pain in your knees or your ankles, your knees, we can help you with that, and including, in addition to, I should say, with the help of your nutritionist that you're talking to.
All right, thanks, Nettie. I'm just seeing, it looks like one more thing here, and the question is it ever too late to start building muscle?
Never, ever, 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 never, ever too late to start building muscle. It does take only 2 weeks to lose a muscle tone, but it does take a little bit longer to build the muscle. But it's better to build the muscle than not have it at all. Absolutely, it's never too late.
Okay, thank you. And actually, one thing just came in is is it true that if you sprain something once, you're more likely to do it again?
In particular, in regarding to the ankle, absolutely. Once you sprain your ankle the first time, you are more susceptible to sprain it again and again if it is not rehabbed properly. Once it is rehabbed properly, we do give you a maintenance program of how to prevent it from happening down the line. And a maintenance program would be something that you would perform maybe 2 times a week to make sure that your muscles are strong enough to reduce any kind of risk of re-injury.
Okay, thanks, Nettie. If anyone will just give it a couple more seconds if you have any questions. Otherwise, I'm just seeing a couple thank yous. Thank you for your time this morning. Thank you for this information. You've given me a lot to think about. So,
all right.
Nettie, thank you for being on.
Appreciate it. Sorry about the audio. I apologize.
It happens. We're at the mercy of the technology. We're just thankful for your time. And I will share this link with you when I have it posted. And I hope everyone enjoys the rest of their day and have a great weekend.
All right. Thank you so much. I appreciate it, guys.